Hello and welcome. I'm Barkha Dutt. You're with The Mojo Story, our digital platform that does a deep dive into one big issue every day. On the program today, the Prime Minister is asking for a Tika Utsav, but where are the Tikas? From Andhra Pradesh to Haryana, from Uttar Pradesh to Telangana, we are getting reports and our reporters are on the ground confirming this, that vaccine centers are running short. There is a clear supply line problem, and there might even be a problem in the supplies themselves. Take a look at these first set of pictures that have come to us from Mumbai. This is one of the big jumbo vaccination centers in the heart of the city in Bandra, the BKC Bandra center that was vaccinating about 4,000 people every day, or aimed to. Today it says unavailability of stock. The center is temporarily closed. Now remember, there has been, those are the people waiting outside, and they were turned away today as the center said that there are simply no vaccines available. And if you think that this is a BJP versus non-BJP fight, well, think again. Our ground reports confirm that BJP-ruled states, Haryana, Uttar Pradesh to name two, we have ground reports from there confirming that even the elderly, who are identified as the most vulnerable groups, are now unable to get their second dose, scheduled second dose, in particular of Covaxin, of which there is, of course, much smaller production than of the other vaccine, Covishield. Take a look at what the states are saying. How many days do they have stocks left for? Andhra Pradesh, for example, is saying it has vaccines just for 1.2 days. The government is saying there are more in the pipeline, but this is the real-time figures that the states are providing. And like I said, this is cutting across party lines. Bihar is a BJP alliance state which has vaccine stocks to last 1.6 days. That's less than 2 days. This is the Times of India reporting this today, but we are independently corroborating this on the ground from many vaccine centers. UP, another BJP state, has vaccine stocks to last 2.5 days. Again and again, I will emphasize, this does not mean that there are not vaccines in the stockpile. The center can release more, but this is real-time figures. Uttarakhand has vaccine stocks to last 2.9 days. That's less than 3 days. And the Union Health Minister is not accepting a vaccine shortage. He's saying that there was 100 million stockpile and there will be more released. Odisha facing a real problem. 700 vaccine centers have actually closed down temporarily in Odisha, and the Health Minister of Odisha has sounded a warning there, saying we just don't have enough stocks. Madhya Pradesh, another BJP state, has vaccine stocks to last 3.5 days. I'm emphasizing who's in the state to make the point that we as citizens are not concerned with BJP, Congress, Konsi party here. We're simply telling you what the states themselves are saying. Maharashtra, of course, according to the Times of India, has 3.8 days worth of stock. Maharashtra itself says it has less than 2 days. So this is the situation that we are finding overall. And the Prime Minister is calling for a focus in combating COVID that takes us back to testing and tracing. Is that feasible? The world is getting on with vaccines and trying to reclaim lives. What's going wrong with our vaccine rollout program? Let us introduce on the show today to get a sense from experts on what's going wrong, what's going right, and what can still be done. First, from the hotspot, the COVID hotspot of the country, Dr. Hemant Deshmukh, the Dean of the KEM Hospital in 2020 and 2021, the hospital at the front line of the COVID battle in Mumbai. Thank you, Dr. Deshmukh, for sparing time. Dr. Navin Dang, if there's anyone who can tell us whether we can still go back to testing and tracing, it is Dr. Dang, who has been at the forefront of those RT-PCR tests for COVID through the year. Thank you, Dr. Dang. Dhiraj Nayyar, Chief Economist with Vedanta, has worked with the Niti Aayog, can tell us where the data is pointing us. What is the data telling us? We need to be guided by the numbers, not by the politics, not by emotion, not by tutu meme. And finally, Professor Virander Chauhan, one of our foremost scientists who spent his life to the study and creation and development of vaccines, is with us on the program. Thank you so much. First, I want to get a sense from Dr. Deshmukh on how bad it is in Maharashtra. Because what we know is that the Prime Minister is not going to give extra vaccines to Maharashtra. His conversation with the Chief Ministers cleared that. He said all states will have to manage. We need to go back to testing and tracing. Dr. Deshmukh, if you can first start by telling us what is the situation at your hospital.
The situation on the ground, that is in the city of Mumbai, which is managed by the entire Municipal Corporation of Greater Mumbai, is worse than what it was in 2020. The lowest figures that I got in the month of February for all critical patients was just 15, which was the lowest. That was probably in the second week of Feb. And right now I have almost 300 patients. Almost everybody is critical here. We have admitted them in the most critical care units of the hospital. So you can imagine from 15 to 20 times increase in the last just about 6 weeks of time. And you can see the multitude of people, that is, you know, the most serious patients that get admitted to KEM hospital. And if the situation at the ground is so grim, I can imagine the number of patients who are coming into the city or in the state of Maharashtra or elsewhere, because the virus does not respect borders, I suppose. So the situation is likely to be grim all over the country, not necessarily either Mumbai or Maharashtra, but the catch-up will always happen with the virus with other states also. And this is my confirmed belief that unless you stop, some kind of COVID inappropriate behavior, the situation is likely to worsen further. And I keep reiterating that the three basic pillars of prevention of any pandemic is definitely something which is called as hand sanitization, a basic hygiene method, then something which is called as masking. People have forgotten. That's why I'm saying something which is called as masking, and definitely some kind of social distance or a physical distance between two people. Now, when I say two people, it simply means that Japan, in fact, has a crowd which is designated as two people. In Maharashtra or in Mumbai or India, we designate 5 or 10 or 50 as a crowd. And I think we should follow Japan and say that 2 is a crowd. And definitely this social distancing will keep the virus at bay right now.
I wonder, Dr. Deshmukh, how we convince our politicians of all parties that 2 is a crowd when there are hundreds, if not thousands, of their election rallies. It is absolutely bizarre that the governments are telling people to be COVID appropriate when no Neta is following this. And take a look at those figures. And like I said, I really have no political preference here. It can be Mamata Banerjee one day, it can be the BJP the next day, it can be Rahul Gandhi the third day. They're all the same as far as COVID inappropriate behavior is concerned. But Dr. Deshmukh, I want to come back to something you said. You said, speaking about your hospital, that there is a 15 to 20 times increase in the number of serious cases you're getting in the last couple of weeks. Is that correct?
Yeah, this is probably from 10th of February to, this is exactly 2 months right now.
Yeah. Can I ask you what you find different? Because you've seen this surge. I was in Mumbai through 2020 when you were seeing that surge. Is there any difference you find in, one is, of course, all of you have got better at treating this virus. There are things you know now that you didn't know earlier. For example, oxygen being more important than ventilators. You have a kind of combination of medicines, whether it's a paracetamol, steroids, remdesivir in some cases. We kind of know what you do. You know, of course, what you do better than you did last year. Is there any other difference that you're finding on the ground between this surge and 2020?
Yeah, definitely the clinical presentation of COVID right now is definitely very different. What we were seeing last year was what is called as SARI, that is severe acute respiratory illness, in which the RT-PCR test was almost always negative because unless it is positive, we never label the patient as COVID. So this time, more of patients are coming with COVID positive reports. The clinical difference is that these patients are coming not with cough or cold or fever, but they are coming with all possible bizarre neurological or gastrointestinal symptoms. That is either pain in abdomen, intestinal pain, intestinal hurry, loose motion, diarrhea, dysentery, some kind of headaches. Most of them come with either a stroke or heart attack. And this bizarre clinical appearance is definitely because of the COVID virus, which causes some kind of thrombotic phenomenon in the body. Some of the blood vessels as well as the veins of the body get blocked. And this creates a huge impact on the hematological disorder of the entire body. These patients
so the symptoms are no longer lung,
the classic ones. Yes, not the classic ones, because now the patients have become so educated about COVID symptoms that when they come here, they don't tell the symptoms. They say that I have good smell. I can smell everything. I can taste everything. I have no fever, I have no headache, but there is mild cough. And most of the patients are coming to the hospital with a CT scan. Can you imagine that last year we never did a CT scan of patients, but as the diagnostic center started opening up, now the artificial intelligence has taken over the CT scan of the chest, what we call as the high resolution CT scan of the thorax. And there's something which is called as CORADS, that is a scoring system, wherein we actually describe the severity of the lung affected. Now, these patients are coming with a CT scan. These patients are coming with partial treatment. And when their oxygen levels, that is the SpO2 level, drops to a significant level, they are rushing to a hospital for a critical bed. And none of them want to actually get admitted to a something which is called as a jumbo center in Mumbai. That is a field hospital in Mumbai, because
Yes.
the class of people right now getting admitted are not from the slums, not from the lower strata of society, but they are definitely from the higher middle class, the neo rich class, and they want a critical bed in a separate room.
But is that
rather
a
than in
reasonable demand? Is that a reasonable demand? Because I'm going to ask you something complicated now. Are you running short of beds? And that cannot be because the rich want private rooms. Strictly speaking, does Mumbai have enough beds if we weren't indulging the desire for the upper middle class to have separate rooms or beds? Are you in that situation now? Because you said 300 critical patients, all critical. Do you have enough high flow oxygen beds? That's what I would say matters in COVID.
Yeah, we have learned from 2020. So we know what is required for each bed. Almost all our beds are oxygenated right now. And we have been running a campaign for the public of Mumbai that whatever bed you get, wherever you get, I think you should occupy a bed first and then think about transferring to a place of your choice, either back to your home or some kind of fancy hospital in the city of Mumbai. We are still not running short of critical beds or in fact normal beds also in the city of Mumbai. But the preference of people is driving us crazy. They want a specific set of surroundings, and this is entirely because they feel that they can afford a bed. But the bed is not there for them in the private. It's there very much in the public setup. And we are not something which we don't know how to treat a COVID patient. We may not have the luxuries of a private hospital, but we have remdesivir, we have oxygen, we have ICU care, we have plasma if they are really wanting it, and we have a good set of doctors all the time.
Yeah, and I mean, I have to say that I almost feel no patience at this point for people who are getting finicky about where they're getting admitted, because the strain that's putting on city infrastructure, on governments, then panicky push down into lockdowns. I will come back to you, Dr. Deshmukh. I want to now get Dr. Dang into the conversation. The Prime Minister is taking us back to testing and tracing. The world is vaccinating. New York is vaccinating 16-year-olds. The United Kingdom has vaccinated 60% of its population, Dr. Dang. Before I come to you, if we were to just take up the slide of how we are doing on the vaccinations. Now, it is true that in absolute numbers, we're not doing that badly. We have about over 93 million vaccination doses already. Can we come out of the state graphic and take a look at the overall graphic? We have 93 million vaccination doses already. We are amongst the fastest vaccinating countries in the world. And this is how many people vaccination doses were completed in the last 24 hours. We're back to a 3.6 million figure. So that's a good thing. That number had fallen. But Dr. Dang, you don't need me to tell you this, that as a percentage of the population, it doesn't help us to be the fastest vaccinating country in the world, because we are still, while high on absolute numbers, very, very low on relative numbers. These numbers are not enough to take us out of the pandemic, even though more than 94 million vaccine doses have been completed. And as we showed you in the beginning of the program, states everywhere are saying that they have under 3 days of vaccination supplies left. We're still only under 7% of India vaccinated. Can we practically go back, Dr. Dang, to testing and tracing?
Barkha, testing and tracing was the policy 1 year back. I remember talking to you about 1 year back. That was the time when that was the most important thing of testing, tracing, tracking. But now the baton has passed on to vaccination. We have been constantly being told to increase the capacity. I think all of us have reached the maximum pinnacle of our capacity. We cannot go beyond that. To increase the capacity, it means more space, more manpower, more equipment, and all the other ancillary things required. Since the March last time, our capacity of the entire private sector has gone up much beyond what we even thought that time we'll be able to do. So this is it. This is a maximum that we have. Till the time some miracle happens and we're able to get more space, more manpower, more equipment, everything at a very subsidized price, etc., etc., etc. I don't think it will be possible for us to increase the capacity beyond this. So the focus has to be on vaccination. The focus has to be, as Dr. Deshmukh has very, very well put it, my compliments to you, Dr. Deshmukh. He has put it so well that now we have to focus on the fact of creating social awareness to see that we become more socially conscious about it and not look wherever we get beds, whether we are getting good beds, bad beds, etc. I think this time, all compliments to the government hospitals. They're doing a wonderful job. They're doing a phenomenally great job. I do not see any reason that why people should prefer the private hospitals if beds are not available out there. So tracking, tracing, and testing, yes, has to be there, but emphasis has to shift from there to vaccination and to COVID social appropriate behavior.
Can you elaborate on something you just said? It's on the screen. Need more manpower and space for more testing, cannot go beyond present testing capacity. Can you explain why? Why can Dang Labs not test more than it's testing? What is the reason?
Barkha, you require BSL-2 capacity. That requires space. I have got, say, 25,000 square feet area for my lab. I utilize most of it. There are, of course, other patients coming for other equally essential investigations and tests also. I have my chemo patients coming, I have my hepatitis patients, I have got my kidney patients, etc., etc., etc. They're all going on. Certain space was demarcated when we started in March last year for our COVID testing. We could make it double, we could make it triple. From where do you get more place? 5,000 square feet, 7,000 square feet. How much more can I get space? I cannot get more space. Manpower, at that time I had maybe just a handful of molecular biologists in the team, but now I require much more. From where do I get more people? From where do I get more molecular biologists? From where do I get more technicians? They say go and collect samples. And I think the government simply closes the eyes to the fact that if a person is going to collect the sample at somebody's house, he has to be paid a certain amount. Now, imagine that technician going out there, he's putting his face in front of a potentially positive COVID patient and taking samples from there. Don't you think he has to be paid for it? And here there's the only thing I feel government wants to understand is decrease the rates, cap the rates. Arey Baba, if we cap the rates, from where do we get the money to invest into buying more equipment? And as all scientists out here, Dr. Chauhan is out here, Prof Deshmukh is out here, they all know that to buy an extractor, to put up one more BSL capacity infrastructure system, to have a RT-PCR machine, everything costs money and goes into crores. From where do you get more manpower? Everything is chock-a-block full. Nobody wants to work in a lab. Rather, people are leaving. They prefer going and working in a cloth shop than being in a dangerous zone like that of a medical establishment, especially a COVID lab. To incentivize them, we have to pay them. And here, on the other hand, payments are stuck. On the other hand, the costs which has been capped are so unaffordable and not sustainable that I do not think most of the labs will be able to go beyond a certain capacity.
Can you elaborate what you mean by payments are stuck? You made a statement, payments are stuck. Payments from whom?
I think lots of labs. Look, when I'm talking, I'm not talking on behalf of Dr. Dang's lab only. I'm talking on behalf of large number of other labs also, big and small both. Government has been getting tests done from different labs and everything has been done on credit. And if you see that most of the labs have not received the complete payments, at least what we request is that if the pending payments have to be released to the labs, then only they'll be able to invest into something more. That's what I meant when I said that payments are stuck, we are not being paid. So payments stuck, costs into just a couple of hundreds, in which the profit is no margin of profit, rather it is not even sustainable. We are paying out of our own pockets, not being able to get good manpower, Nobody wants to work in a medical establishment collecting samples, especially the people who are going and collecting samples for COVID, finding a challenge to get them, challenge in getting trained molecular biologists. What is available is equipment for, but for that we don't have any money. And from where do you get more space? Space is a big challenge. But Barkha, you have been to my lab a number of times, you know it, that in spite of the fact that it is one of the biggest centers in Delhi, but it is now exhausted to the maximum. There's not even a place where I can say put one more additional machine.
I mean, you're painting a very grim picture. You're making it actually, I would have thought by now we would have totally smoothened out our testing mechanisms. We could have had mobile vans, drive-ins. You did a drive-in. This should have got a lot simpler. You're making it seem like it's actually got tougher instead of easier.
No, Barkha, no. I think I'll clarify myself that we are much better off than what we were 1 year back. We are phenomenally better off. That time we did not even know from where to get what. Now everything is there in place. Your question to me was how to increase the capacity. We are constantly told to increase the capacity. What we are doing is very smooth. We are very comfortable. We can do all the tests with the eyes closed. I think here my request to the government is that we have got so many good government hospitals. It may be like I'm talking about Delhi MCD hospital, Delhi government hospitals, dispensaries, etc. Doing PCR tests is no rocket science. Why can't those hospitals have a lab of their own where we can have lots of patients can go and get their result tested at subsidized rates? People who can afford to, they can come to the private hospitals. People who cannot afford to, they can.
So you want a differential. You want a differential pricing, basically, is what I'm hearing.
Pricing is one of the issues, but by having more PCR centers in the government hospitals, I'm not talking about larger hospitals like KM and Morales, etc. I'm talking about the small dispensaries, small MCD hospitals, etc.
The upshot of what you're saying is going back to testing and tracing is no longer a feasible way to fight COVID.
Exactly.
Okay. So this brings us back to vaccines, and I want to now get Professor Veer Chauhan in. And Professor Chauhan, now here's what's happening. There's going to be a huge debate over whether we should have exported or gifted any vaccines at all. But what we do not yet know is why the center is not tapping more into its stockpile. We know that there were 100 million doses that were given by the Serum Institute to the government. We know that Bharat Biotech produces about 6 million a month, and other Poonawalla of Serum Institute produces about 60 million. Yet state after state after state is complaining of a vaccine shortage. We'll play those pictures again if we can of what's happening in Mumbai, where 26 centers have closed down, including one of the biggest centers, which we showed you in the beginning. Can we play those pictures again? This is Bandra, BKC. And let me tell you, our reporters on the ground, Professor Chauhan, are now saying we have a report coming up later today where elderly people, mostly retired people in the late 70s or 80s, on the borders of Delhi and Haryana had to get their scheduled second dose of Covaxin. When they went to their center, they were told that is not available. And we had identified the elderly as amongst the most vulnerable. Now people are worried. Health ministers and states are saying what will happen to the schedule of the second dose. What is your estimation, Professor Chauhan? What is actually going on here? What are we doing wrong?
So, Barkha, if the numbers that you gave, first of all, if there are stocks which are lying undistributed, then I think somebody has to very quickly take care of that and distribute them.
Yeah.
How would you do? I think the information that you and I have to throw people should be available with people who are dealing with these situations. For example, you said that the SII can produce about 60 million doses.
This is what they told me. This is what Mr. Poonawalla told me. So I'm going with that.
I've been hearing, slightly going away from what you say, that everybody say, why don't we ramp up our production of vaccine? And ramping up a production of vaccine is not just, you say ramp up, and just as my friend Lang is saying, you just can't sort of go to bed and then next day you ramp up. Vaccine, you have to produce bulk, you are dependent on 20 different ingredients, your media, your filters, your filling, your tubes, everything come mostly imported. You need stocks. right now there is a short supply all over the world. I think we just forget sometimes, because Indian situation is becoming so bad, that there is a huge gap in the world. And there are people who haven't even started vaccination in this country. But let me just stay back to the problem that currently we are discussing. So let's say 100 million doses are available every month. And let's say there is no wastage and you can distribute. And let's say the distribution problem is also sorted out. You could argue that where there is more infection, please give them a little bit more. And I think that's fine. But let there be a dashboard that this is the stock that we have. This is the way we are going to distribute. This will be our distribution pattern. This will be our time of distribution, so that we don't panic. We have only 1 day stock. I personally think we should accept easily and readily, so that people come know that there would be short supply. There is going to be a supply problem. There is a supply problem. We all need to go back for our second shot. So if we immunize 9 crores, you need 9 crores, at least 8 crores now extra shot to completely immunize me.
But so why are we short? Why are we short? And if we can't go back to testing, as was urged in the meeting between the Prime Minister and the Chief Ministers, you heard Dr. Dang, then what are we to do? My answer would be mask up and live, because you know what? The pandemic isn't going away. So the virus isn't going away. It's going to keep mutating. It could be around for years. What are the answers at this point?
So let me quickly add science to this. If the pandemic is not curbed, and I'll very strongly urge that society has an equally big role, if not bigger role to play. I think we just need to go back to behavior. So if somebody says you come to this or that, I think we have a responsibility not to go this, that, and there. I think that should not be shoved away. But on this channel, to you, I had said about a month back, we were in a more comfortable spot about 2 months back. And I had argued that is a time when we should have finished as much as we could. Now we are in crisis. Yeah. My suggestion would be, let us not think that there is not a problem. I think we are heading into a very serious problem. This problem would peak in about 2 to 3 weeks right now, or maybe more. If virus is allowed to multiply as much as we are letting it, not in this country, anywhere, whether it's Brazil or Portugal or South Africa, doesn't matter. The mutants will come. And what we haven't discussed here, you may vaccinate me tomorrow, and if I have escaped mutant, and humans are behaving as if escape mutants will not come. I can show you as a virologist, as a scientist, escape mutants will develop.
But I would say that the virus will mutate for years. We can't stop living for years. We can't be hunkered down for years, Professor Chauhan.
So virus mutates for both sides. Virus mutates also to disappear. Virus also mutates to make you more unhappy. Right now, in a race with the virus and humans, we throw science at them and virus. But don't think all mutation of virus. And this is how viruses disappear or become endemic. In fact, there are enough data, and I was amazed to read even Ramanathan had said that we've seen the peak of COVID now all over the world. And how wrong we were. Because the second wave, France is locked down completely. Italy is completely locked down right now. Germany is partially locked down. Brazil is on fire. I don't think we got off anywhere from the peak. But what you're saying is really not correct. Viruses also disappear slowly. But this one, we just don't know enough about this.
Let me ask you a separate question. Do we need to immediately do emergency use authorization for more vaccines? Now, no, 1 minute. To which the government says bridging trials have not been done. That process will take 3 months. Pfizer withdrew its application after it was asked to do local trials. But we have a J&J, we have a Sputnik. You have, with all its storage problems, Moderna. There are other options, but we are not acting fast on that. If we can't produce, we need to import. We need to let the market take over. We need to shelve some of our moral problems with vaccine equity right now in the interest of getting more people vaccinated. Those who can pay for it should pay for it.
Absolutely, yes. There's absolutely no running away. But don't think Moderna and Pfizer are waiting you to order their vaccines. They are oversubscribed. In fact, I said it to you last year. The top of the north of this globe has already cornered 60% of all vaccines for the 19% of the population. But coming back, Sputnik, for example, or wherever the trials have been done, vaccines are safe. And India would, trust me, by June, July, you would be supplying vaccine to the rest of the world. Morally, you'll be supplying. So I don't see why Sputnik should not be immediately. If the Hyderabad company can produce Sputnik, I think in a day or two you'll probably see Sputnik. It could have been faster. I totally agree with this. There is no time to waste, not even a minute. I think Sputnik can come easily. Johnson & Johnson will be producing biological evidence. I think we should be very, very quickly looking at Johnson & Johnson. Novavax will come, should come. But you can see...
I mean, Novavax, the Serum Institute says it can't provide Novavax till September. The Serum Institute says it can't ramp up production till June. You say we don't have a minute to waste. We're already talking about 2 to 3 months timelines. Where are these timelines given the surge? I want to come to Dhiraj, but very quickly. Yeah.
Very quickly. 3 months is minimum, you'll ask. I would start preparing now and tell everybody that it does take that much time to have an assembly line, to produce the bulk. Bulk to the bottle toss take you 85 days. Vaccines have to be safe. Vaccines have to be effective. You can't play around with vaccines. So this problem need to be under. No point saying there's no problem. We'll manage. We have enough stock. I think that narrative should change. We should agree there's a problem.
Yeah, but Dhiraj, the Prime Minister very much emphasized testing. You heard what Dr. Dang said. Actually, I was quite alarmed to hear the grimness of perspective on testing, being a solution. But I saw on Twitter you said, and Professor Chauhan and Dr. Deshmukh are bearing that out. We can't have vaccines fast enough now to take us out of this pandemic unless we import ASAP, right? But I don't know how long those timelines would take. What is the data pointing us to, Dhiraj?
No, I think the mess we are in is in part a reflection of what I always say, that bureaucrats and administrators are not good managers and not good judges of demand and supply. We've tried this in India, from 1947 to 1991 with bureaucrats trying to control production, supply, pricing. And you're trying to do it again, and it'll never work because this is exactly what will happen. I don't think even at this present point, the arithmetic which you read out earlier, it doesn't add up. We would have to have plenty of spare vaccine, but the problem is that it's not in the place where it's needed. So again, bureaucrats, this is where markets are superior. They can do the allocation efficiently. Bureaucrats cannot. And I don't think you'll get a vaccine ramp up either as long as if you control prices. I think Dr. Dang mentioned price control in a different context. But the fact is that Mr. Adar Poonawala or Mr. Ella of Bharat Biotech or anybody else who's going to produce Sputnik does not have an incentive to do so if you're going to cap prices at 250 rupees and, procure it at 100 or whatever the government is procuring it at. The government has to understand that it must let the forces of demand and supply function on their own. Otherwise, you will keep getting these disequilibriums. This basic Econ 101, right? Now, you have to subsidize the poor. I understand that. So do that, right? You have a CoWIN app, which can be a system of queuing. Do that. Yeah. You have regulatory power, so you can approve more vaccines. Do that. But that's all the government should do. Subsidize the poor, create a queuing system, and give more regulatory approvals. Let the markets work to some extent. Otherwise, you will not get a supply response of the kind we're waiting for, even if you authorize, because Pfizer and Moderna are not going to come and sell you at 100 rupees. Similarly, I don't know how much the others will ramp up if they have to sell at 100 rupees. This is the reality, right? There's no point being moralistic about profits and so on. And as Mr. Dang said, the pharma companies all need the money, right? They're spending on R&D. They need to ramp up production for not just this year. As you said, COVID may be around for 3-4 years. So they have to produce it every year with greater capacity, with improved products to meet the variants. So I think it's a bizarre highly centralized control model, which has not worked in the past. It has not worked in any country. Countries have collapsed because of it, very well, because of the fear of demand and supply. So I think we are not trusting the forces of demand and supply, and this is why we are in a mess. I don't think, again, let me repeat, the numbers don't show that there's a shortage at this point. There may be 1 month from now as we ramp up.
But at the vaccine centers, now I don't know if the supply problem, and Dr. Deshmukh, I'll come to you on this, is the supply. What we don't know is the following. We don't know, states say we are not getting the vaccines from the center. Center says the states are not managing their own supply lines properly. I don't know what the truth is. What I do know is at vaccine centers that I have personally been to, there are notices on the wall saying, please come again. Dhiraj.
The problem is that it's one set of bureaucrats managing it at the center and another set of bureaucrats managing it at the state. Now, between them, what they are doing is clearly not efficient. And unfortunately, a far more decentralized approach would have been much better, where hospitals, both government and private, could have procured it directly from the manufacturers, and the government could have done a refund or subsidy. This control, as I said, whether it's the central bureaucrats who are to blame or the state bureaucrats, because ultimately the center may be sending it to the capital of a state, and this capital bureaucrats there may have to pass it on to the various districts and various hospitals. It's a tall task, and it will not be done this way. It's the wrong way, and you can say whatever you want, but this inefficiency will continue even when supply goes up, because bureaucrats and administrations are not good at distribution. Yeah. They're not good at pricing. They're not good at managing demand. So it's not going to work. I'm sorry to say this. I mean, I don't want to be a market fundamentalist, and I don't think markets solve everything. But in this particular case, we are seeing the blatant inefficiency of highly centralized and a highly controlled system of distributing vaccines. And we are paying the price for it because, at the end of the day, I think there's also fatigue with testing, tracing, containment. I just don't think, people are up to it or feel energetic enough to do that all over again. Yeah. So the answer is definitely in vaccines. And I think we're already too late. So this surge, somehow with appropriate behavior, we have to beat this particular surge. But there may be another one. So I don't want this, in January, we were in a good position. We had no cases, very few cases, and a lot of vaccines. And now suddenly we're in a situation where we have a lot of cases, very few vaccines. And let's not get into that again. This should be the last episode, because this virus isn't going away. I hope Dr. Chauhan is right and it eventually mutates itself out of our lives. But if it doesn't, we don't want to be repeatedly caught in this cycle.
Yeah. Let me go around the panel once again. Dr. Deshmukh, what is the biggest challenge? In 2020, the challenge was sometimes oxygen supply. Even now, there are states that are complaining of remdesivir running short. Again, we don't know if it's being hoarded, if there's a black market operating. We already have caps on the use of industrial oxygen in Maharashtra and Gujarat. On the ground in KEM in Mumbai, what are the biggest challenges that doctors are facing?
The biggest challenge, Barkha, is definitely not to do with anything of the medications, but it is more of people behavior. Some people really just don't want to behave appropriately. That's my entire answer to whatever you can say. The prevention of this disease lies within the hands of the people itself. I've always been telling there should be micro containments. The lockdowns and what you can say will be the last and definitely a very lazy option for any corporation or any government in the entire country. Definitely a lockdown is not the answer. It is the behavior, and we definitely are not looking at the energy of the doctors and the healthcare workers now. They are definitely worn out. They definitely feel weak right now. And the new amount of enthusiasm that we want within the cadre of healthcare workers is lacking right now. But definitely a need of the hour is definitely a good appropriate behavior.
Talk a little bit about what you just said, that doctors are worn out and weak. I mean, are you basically, doctors must be exhausted right now?
Yes, very much. Myself or any healthcare worker, if you take, I think we are working hard for the last 1 year. We will continue to work hard. I'm not saying no. The energy is not there. In general, there's some kind of viremia within the climate and the atmosphere altogether, not necessarily the COVID virus, but there are probably challenging and, different kind of viruses right now moving around. And that keeps you indoor for some time. You are run down for fever and weakness. And the enthusiasm is definitely not there. The passion will remain. Yeah,
that's sad, but it's inevitable, because how long can health workers keep going as if they're superhumans? Dr. Deshmukh, and just to take this time to appreciate what everyone at the front line in health workers are doing. Dr. Deshmukh, I must ask you before I go to Dr. Dang, is there any reason, and I don't want to get attached to this hope, but some doctors are saying that while the second surge is much more transmittable, it's possibly less lethal. Is there any reason to believe that at this point, or do we not know enough yet?
Definitely not. We are just 2 weeks in the entire surge right now. The peak is probably coming. and definitely the mortality may increase if adequate medical as well as social care is not taken right now. The deaths will happen because people are coming quite late in the stage of the disease. They are coming at least 4 to 5 days later than their first symptom. And one should remember that the cytokine storm is going to come at day 6 or day 7, or maybe earlier than that also. And this needs to be kept in mind. And home quarantine, for all you know, may not be the answer. We definitely want people, though mildly symptomatic, come to institutional quarantine rather than risk their life at home.
Yeah, and not insist, please, on private rooms. The rich of this country need to get over themselves. We would all like private rooms if we could have them. We've all rung up doctor friends and said, "Kamra dilwado," but now is not the time to behave in that fashion. We need to just toughen up a little bit. Dr. Dang, because you have painted such a grim picture of not being able to expand testing, if, as Dhiraj was saying, there was a price differential, if market forces were allowed to function, would it make any difference? Of course, there are ethical issues about equity, but there has to be some separation now. We have to swallow. You see, perfect can't be the enemy of good. We can't find a completely ideal solution here out of this mess.
What Dhiraj just said is absolutely right, Barkha. Let the market forces govern the prices. Once
of testing as well?
Yes, of course.
Okay.
If those who can afford to pay, if we're able to charge, they can be capped to the maximum that we can charge, maybe, prevent any kind of an unethical practice occurring. But do not go down to a level where it becomes not sustainable. If we have enough financial resources, with that we can buy more place, we can have more equipment, we can have more manpower, and maybe we can expand our testing capacity more. But testing capacity, like what we have all been discussing, is not the only answer. Again, the same thing for vaccines also. Let there be no caps and unrealistic caps like 250 rupees, 150 rupees. Like what we have for testing, 500, 700, 800,000 rupees. They're so unrealistic that we have got no incentive to at least expand also. Because for expanding, we require finances. Already the healthcare industry, already all of us have suffered huge losses in the last 1 year. We have been doing it, and people like us all are very happy that we could do the best for our country. We could do the best for our people. And I think all of us who are doctors love our profession, love looking after patients. We chose to become doctors because we want to be doctors and we want to look after patients. But there has to be a certain line. We cannot go that. If we are not able to survive, then how will we deliver? So for that, I request that the capping, ceiling, etc. should be stopped. Let the market forces govern the prices. Those who can afford to pay, let them pay for it. And thus that can be used for subsidizing the costs of the people who cannot afford to pay.
Yeah.
And of course,
okay.
Not the least, let the government ramp up its own testing capacity also.
Yeah. Very quickly to Dhiraj and Professor Chauhan. Dhiraj, to you first. I mean, I think Dr. Dang's pretty much making the argument that that if you want to see results, now there will be an ethical pushback on the arguments we're making on this program. The ethical pushback will be that you can't have differential access to either vaccines or testing in a crisis. And while I see the point of that, I'm saying the larger good, the greater good right now is to get as many people vaccinated as possible, to get as many people tested as possible. So we've got to compromise somewhere.
Yeah, and, I think, again, this is a wrong notion that we have in this country that anything that's run by market forces will exploit the people. Look, everybody has a mobile phone in India and the cheapest data in the world because of market forces. More people are flying today than they ever flew in state monopoly because of market forces, right? So there's adequate competition and adequate enterprise, which will only come in if there is incentive, right? So people will have different models. Maybe this Dr. Dang will have one model, but there'll be somebody else who will have a different model who can scale up at a different level and give it cheaper, right? Let the market come up with cheaper options also. And to the extent that you have equity considerations in government centers, continue to give it free or highly subsidized, or, you have the provision of direct transfers now. Let people upload a receipt and the government can give them a refund or bridge the gap between. That's much more efficient than not allowing private sector to wrap up capacity because they don't have the money to do it. So I think even in vaccination, my view is that instead of capping, the government should be doing the contrary. They should be helping the private pharma manufacturers in whatever way possible, including by viability gap funding or any other emergency funding they need, so that they ramp up, so that Mr. Poonawalla makes 100 million doses a month, and Mr. Ella makes 20 million doses a month, and Sputnik makes another 50. So I think the thinking needs to change. I think we're still stuck in the old style rationing approach, which we are used to in India. But I think we need to just ensure abundant supply and do everything that's possible, and not shy away from profit and private sector. This crisis without the private sector.
I agree with you. And Professor Chauhan, I want to give you the last word. You said Sputnik is one vaccine that could be brought in immediately. It has an Indian manufacturing partner. The Serum Institute is very clear. Novavax is not coming till September. Even on the ramping up, it's identifying June is the timeline, subject to a 3,000 crore cash infusion that it needs, 50% of which it says it will pay. It needs 50% from government. What is our best case way forward right now, Professor Chauhan?
I have three very quick points to make. Two are scientific, and I'll address your question the last. One is that all of us know by the field, and in fact, Punjab government said it about 3 weeks back, that the second wave, which is more deadly, more infective viruses, that is driven by mutants. We don't know the mutants' behavior now, so let's be very clear. The current wave that you see is that's why the infections are different, outcome of infection are different. Number one. Number two, yes, this morning I saw news that in Gangaram Hospital, large number of doctors were tested positive. So what does that indicate to you? So we initially said all health lines, especially doctors and nurses, must be vaccinated. So I would imagine if 80% of people were vaccinated, there was no vaccine hesitancy, then there was no business of in one hospital, such large number of people would have got the virus. The two things. Conclusion is either the vaccines don't work or people did not get vaccinated.
Or just to ask the question, they've got infected, but they're not suffering terribly. Only 5 have been hospitalized. One of the Gangaram doctors did a very good explanation on this, Professor Chauhan, and he said that the 5 who've been hospitalized all had comorbidities. So the vaccine has probably saved lives. We should not underestimate that.
So let's take it further. If they are infected, if they have the virus, and they are silently, if they are not hospitalized, that means they can spread the virus. And that's true. That's what science says. So therefore, to say that vaccine is right. I think we should do vaccine. But remember then, by your own logic, you're saying that you can be vaccinated, get the virus and spread it. So vaccine cannot be just vaccine.
But when you tell people COVID appropriate behavior and you campaign in 5 states, in hundreds of thousands of people together, so ये आप किसको समझाएंगे COVID appropriate behavior जब नेता खुद नहीं समझता?
Sure. So the mixed messaging is a serious problem in countries like Brazil, like Portugal, like our own country, and many other countries. This mixed messaging must stop. If it doesn't stop, we just face the consequences that are coming. The other science question is that we know now, the data only came day before yesterday, it's a published paper, that the mutant, which is South African mutant, not UK mutant, is really almost an escape mutant. In the case of people who got infection first or got vaccinated based on the first virus, Wuhan virus, may see reduced efficacy of the vaccine. That said, all vaccines are still valid and we should vaccinate. But remember, if you do simple arithmetic, we need to immunize people with 2 doses, even if you give break of 8 weeks, numbers don't match. You and I can do as much shouting wherever. You can get Sputnik tomorrow. Sputnik can give you 20 million or 30 million or 40 million. Your numbers are amazing. Even if the 6 crore that have been exported.
So what's the solution?
What is the solution in Brazil? What is the solution in France? What is the solution in Germany? What is the solution in Italy? You're looking at a very terrible survival race between humans and virus right now. So since we can talk, since we have science, since we can do this and that, I think we should be humble. We should respect the virus. Go back to the basics. Stay home as much. Don't go out as much. And as Dr. Deshmukh rightly said, where there is a lot of spread, like in Kent, in UK in September, you close those areas. You have to go back to closing. You can't lock down nationally, I agree. Otherwise, people will go hungry and people will die and there'll be huge. I agree. But how do you manage? You tell me. There are times when our solutions are not very easy, except that you have a problem, first of all. Humbly accept we have a problem. No mixed messaging. You're messaging from the top or from bottom.
I mean, you have the Kumbh Mela going on. You have elections going on. I mean, what is this messaging? But you lecture people ki aare aap kitne vote hai, irresponsible.
Then you face the consequence. I'm sorry. If you're bad behavior, then you face the consequence.
I hope the grimness of what you just said, survival. It's a survival battle between human beings and the virus. Chilling words. I hope we'll take away the message that we need to. At the same time, I must say that I'm not a fan of lockdowns at all. I think we need to mask up. We know some things better than we did. We know, for example, the CDC now says it doesn't come from surfaces, that fear of fomites. We know more than we did. We've got to be able to action what we know and behave on the basis of that. You wanting one sentence there, sir? I was just closing. Professor Chauhan?
So Raipur is locked down yesterday, and you'll see in 10 days, you see the virus going down. Raipur is completely locked down.
Sir, but can we put the world under lock and key?
So you say, what should we do?
Dhiraj, you wanted to come in?
Barkha, I think lockdown is not feasible. I agree with you. But, and I think politicians have to lead on this. I know elections are on. You have to curb large gatherings. I mean, Dr. Deshmukh, I think, said 2 is a crowd. Maybe not 2, but you have to keep it down to 5 or 10. It's just, I mean, this time is there. There's no other option. Unless you want a really, really bad crisis on you.
Yeah, I think we can agree on that note, leaving it there. Dr. Dang, Dr. Deshmukh, Professor Chauhan, Dhiraj, and please, in gratitude to all the doctors, Dr. Deshmukh, I was particularly disturbed to hear how doctors are worn out. It's the truth. And just out of respect for those who are risking their lives every day, we really all ought to be behaving much better than we are. Otherwise it is just so many moral questions that arise. Who are they even risking their lives for if we're not even going to behave with some sense of responsibility? And by the way, dear politicians, that applies to all of you as well, who are running elections across 5 states. You cannot lecture citizens about COVID-appropriate behavior if those gatherings are taking place without masks. Leaving it there, thank you to our panel and to our audience. See you tomorrow, same time, same place. Thank you for watching. Goodbye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.